Hi, I'm Sarah Fuller. I'm an RN working with the Concurrent Disorder Capacity Building team. Today we'll be reviewing Mental Health 101, and this includes talking about mood disorders, psychotic disorders, anxiety disorders. We'll touch on personality disorders and trauma, and talk about substance-induced disorders. Mood disorders. Bipolar mood disorder is a medical condition that causes a person to cycle through periods of depression and elevated mood. Bipolar disorder typically consists of three states: a high state, which we call mania, a low state, depression, and a well state, during which many people feel normal and function well. Now, all people experience emotional ups and downs, but the mood swings for people with bipolar disorder are often more extreme and can cause impactful negative consequences. The manic phase. Sometimes a person may seem continuously high, happy, euphoric, or irritable and angry, even aggressive, and this usually lasts a week or more. If this change in mood is accompanied by at least 3 of the following symptoms, the person may be in the manic phase of bipolar disorder. So the person may have an exaggerated self-esteem or feelings of grandeur. The person may be expressing ideas that they're going to be the next king of England, or they have a fantastic idea that's going to make them the next billionaire. The person may have decreased need for sleep. So a person may not be sleeping at all and still seem as though they're full of energy and can keep going. A person may be more talkative than usual. Sometimes the speech is really fast or pressured, maybe stumbling on their words. Person may have racing thoughts, and quite often what people experiencing this explain it as like having a hamster wheel going on in their head. Their thoughts just don't stop and they have trouble keeping up with them. The person can become easily distracted. They may have excessive energy for activities. Quite often though, the person will not finish one activity before moving on to the next. And the person may be engaging in risky behavior or exhibiting poor judgment. The depressive phase. So a person may be experiencing the depressive phase of bipolar disorder if at least 5 of the following symptoms are present for at least 2 weeks and experienced on most days. So they may have a depressed mood. They have loss of interest or pleasure in activities that used to be enjoyable. They can have weight loss or even weight gain. Person may have difficulty sleeping or sleeping too much. Apathy or agitation, so really not caring or getting agitated quite easily, maybe getting into verbal altercations with loved ones or friends. A person may have loss of energy, feelings of worthlessness or guilt, have inability to concentrate. So perhaps someone who used to be an avid reader would have troubles focusing and staying on one page. Thoughts of suicide, which should always be taken seriously. So treatment for bipolar mood disorder. The main treatment options for bipolar disorder are medication and psychotherapy. Often both types of treatment are needed, but in order to bring symptoms under control, it's usually medication that is needed first. The main types of medications used to treat bipolar disorder are mood stabilizers. You may have heard of lithium or Epival, antipsychotics, and or antidepressants. Risk of suicide in people with bipolar mood disorder is 15 times higher than people in the general population. And again, as I mentioned in the previous slide, this should always be taken seriously. Mood disorders can be confused with or exacerbated by substance use. This can make diagnosis difficult, as behaviors resulting from substance use can be similar to symptoms of mania or depression. we would suggest a period of about 6 months substance-free to make an accurate diagnosis. St. Joe's has a mood disorder outpatient clinic, and referrals are accepted from either family doctors, specialist physicians, and other treatment teams. Depression. Depression can be experienced on its own with absence of a bipolar mood disorder. Symptoms are the same as with depression and bipolar disorder, such as depressed mood, difficulty sleeping, sleeping too much, loss of energy, and again, thoughts of suicide, which are always taken seriously. Treatment for depression includes interpersonal therapy. So this is what some people may refer to as talk therapy, often done with a psychiatrist, a psychologist, maybe a social worker or a psychotherapist. Cognitive behavioral therapy, or CBT as commonly referred to. And this is really looking at the thoughts, behaviors, and actions of someone and modifying the way they think, feel, and behave. Psychoeducation, so learning about depression, symptoms, and how to treat, maybe attending groups to help with depression. ECT, so electroconvulsive therapy, which is a lot different than maybe what you have heard of in the past. Transcranial magnetic stimulation and light therapy. Some medications, antidepressants typically take 4 to 6 weeks to take full effect. Person may feel some symptom relief within 2 weeks. And often it can take a trial of 1, 2, or more antidepressants to find one that is effective for the person. Behavioral activation. So this is really looking at helping a person get re-engaged in their community, their environment, their home life, helping them set up a calendar, planning activities, getting them more active. Anxiety disorders. So everyone feels anxiety at one point or another. People with anxiety disorders have severe, persistent anxiety that causes significant distress. Symptoms can include headache, perspiration, heart palpitations, general restlessness, difficulty sleeping, gastric discomfort. Sometimes people will talk about feeling as though they're going to have a heart attack. They can have fearful thoughts, predictions, or beliefs, and avoidance of situations because they felt anxious in them at one time or another. People can catastrophize, believe that the worst is going to happen. Some tend to constantly seek reassurance from others or avoid situations that cause anxious feelings. For example, avoid going to the grocery store if they've had a panic attack there before, or avoid driving on the highway if they've been extremely anxious in that situation before. Anxiety disorders can result from a biological predisposition and social environmental factors. So someone could have the genetic makeup to have an anxiety disorder, or it could be the environment they were brought up in, or if they had a traumatic experience, it may result in an anxiety disorder. There are different types of anxiety disorders, and they include social anxiety. So a person may feel extreme anxiety around other people, maybe have difficulty taking the bus, difficulty going to the mall. And this is more than just typical shyness, as people may think. Obsessive compulsive disorder, OCD. So having the thought to do behaviors repeatedly over and over, maybe checking a light switch, checking the locks on your door. And again, this is more than just questioning if you forgot to turn the stove off. This is disruptive behavior that interferes with a person's ability to carry on their daily routine. Specific phobias, so having extreme fear of a situation or something like a fear of heights, fear of snakes. Again, more than just your typical, not liking spiders. This interferes in the person's ability to carry out their daily activities. Panic disorder. So having panic attacks, usually often just out of the blue, not triggered by something. Generalized anxiety disorder. So this can be an overall general feeling of anxiety that persists through a day, and again, can be not triggered by something specific. And then post-traumatic stress disorder, or PTSD, which is the result of a specific event or chaotic environment, and we'll talk a bit more about that. So there's different treatments for anxiety disorders. So systemic desensitization and exposure therapy. So this would include systemically exposing a person to the source of anxiety or its context without intention of causing danger. So maybe think of public speaking. In very simple terms, the more you do it, the less anxious you become. CBT, or cognitive behavioral therapy, as I touched on earlier. This is quite often done in a group setting. Can be individual, and it's really looking at the thoughts, behaviors, and feelings of a person and looking at modifying that. And again, medications. St. Joe's has an anxiety treatment and research clinic, and referrals can be accepted from a physician, your family doctor, a psychiatrist, or another physician. Psychotic disorders. Schizophrenia. Schizophrenia affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they've lost touch with reality. The development of schizophrenia is related to genetics, substance use, family, environmental factors. Symptoms of schizophrenia usually start between the ages of 16 and 30. In rare cases, children have been diagnosed with schizophrenia. Symptoms of schizophrenia fall into three categories: positive, negative, and cognitive. Positive symptoms. These are the psychotic behaviors. So positive, it does not mean beneficial in this situation. It just means symptoms that are added on to a person's regular presentation. So these could include thought disorder. So this would be, maybe a person seems very disorganized in their speech. They may have difficulty staying on topic, may even have trouble forming a sentence. Hallucinations. These can include auditory, so if a person could be hearing voices, they believe the voices are real. Quite often the voices are negative, derogatory to the person, and sometimes they'll tell the person to do dangerous, risky behaviors. Or a person could have visual hallucinations, so seeing things that others do not see. They could have delusions. So a belief that is firmly maintained despite rational argument. For example, a person might believe that they are the King of England despite family members, friends trying to tell them that they aren't. Negative symptoms. So this is the disruptions to emotion and behavior. So impairment in emotional range. Quite often a person who has psychosis or schizophrenia may appear quite flat in their affect, which may means they don't have a lot of range in their emotional reactions. They could have lack of energy, and lack of enjoyment in their regular activities. Cognitive symptoms. So poor executive functioning. So this is the ability to understand information and use it to make decisions. The person may have trouble focusing or paying attention. You may notice when you're talking to the person that they're easily distracted. They may even look like they're responding to something that you don't see. The person may have problems with their working memory. So easily forgetting things, difficulty recalling things. You may notice having to repeat things over and over to the person. So treatment for schizophrenia includes, again, cognitive behavioral therapy for psychosis, antipsychotic medication. The person may need to be on an ACT team, which is assertive community treatment. And this is a team that follows the person in the community, helps the person stay on their medications, helps the person engage in positive community experiences. Psychoeducational family interventions. So getting family members, friends on board and really getting educated about psychotic disorders can be helpful for the person. St. Joseph's has treatment for psychotic disorders, including the Cleghorn Early Intervention Clinic. So this is for people who are experiencing their first episode of psychosis, so the very first time they're experiencing symptoms, or for people who have had symptoms but have not been treated yet. Referrals are accepted from a physician, so your family doctor, another psychiatrist or treatment team, and the Schizophrenia Outpatient Clinic. So for details regarding this referral process, call the manager 905-527-8515, extension 234. Personality disorders. So different types of personality disorders, we put them into, or the DSM-5 puts them into clusters. So cluster A would be paranoid, schizoid, schizotypal. Cluster B, antisocial, borderline, histrionic, narcissistic personality disorders. And cluster C, avoidant, dependent, and obsessive compulsive. We're going to be talking about borderline personality disorder, which is quite often what we diagnose or see in our clients. So borderline personality disorder includes symptoms of impulsivity. So really acting before thinking of consequences. Can include a pervasive pattern of instability in interpersonal relationships, self-image, and affect. So a person may have trouble keeping friends, may quite often get involved in chaotic relationships. A person can have frequent episodes of self-harm and suicide attempts. And again, these are always taken seriously. And can be characterized by frantic efforts of an individual to avoid real or imagined abandonment. Treatment for borderline personality disorder includes dialectical behavior therapy, DBT, as you may be more familiar with. This involves looking at the dialectics, which means believing that two opposite things can be true at the same time. Quite often, people with borderline personality disorder have that black or white thinking or all or nothing thinking, forgetting that there is a middle ground or that gray area. So an example of this would be, you're doing great and you need to do better. This DBT includes teaching skills for the person to cope with such things as distressing emotions, crisis, interpersonal effectiveness, and managing their emotions. Trauma. Trauma can be a result of many things, and trauma is very individual. And what one person may feel as trauma may not be trauma to another person. It can be a result of a one-time terrible event, like a horrific car accident. It could be a result of a long-term abuse. It could be a major adjustment that impacts more severely than most. So like I said, some people just react differently to situations than others. Our brains and ourselves as humans are very resilient. If we are able to access supports available to us, recovery is possible from almost anything. So treatment for trauma includes cognitive processing therapy and prolonged exposure therapy. So these are usually done with a psychiatrist, psychologist, a trained professional in these treatments. And they include really exposing the person to the trauma and desensitizing them to the trauma. Community Psychiatry Clinic here at St. Joe's and the Anxiety Treatment and Research Center at St. Joe's both provide treatment for trauma. Referrals are accepted to both from physicians and community services. Substance-induced disorders. Depression or mania that is caused by using alcohol, drugs, or medications would be a substance-induced mood disorder. The symptoms may start while you're taking the substance or substances, or within a few days after you stop taking them. With substance-induced depression, the irony is that many people take the substance to feel better, yet those same substances make them feel worse. For this reason, people sometimes don't realize that it is alcohol, drugs, or medications that are causing the way they're feeling because they only associate those substances with positive emotions. Substance-induced psychosis. Very similar to psychosis and schizophrenia, but time limited. This usually resolves once the substance has left the body system. It can happen with crystal methamphetamine, cannabis, mushrooms, too much cocaine, peyote, and withdrawal from alcohol. In longer-term use, like with crystal methamphetamine, for example, the psychosis can persist for up to 6 months after you stop using the substance. People with a mental illness are twice as likely to have a substance use problem compared to the general population. Quite often, this is a chicken or egg situation. We don't know what came first, the mental health, and they're using substances to self-medicate, or the substances themselves have led to mental illness. At least 20% of people with a mental illness have a co-occurring substance use problem. For people who have schizophrenia, the number may be as high as 50%. St. Joe's has a concurrent disorder outpatient clinic, and this specializes in treatment for people who have both substance use disorder and mental illness. This clinic accepts referrals from the individual themselves, referrals from physicians, and other community agencies. If you're looking for more information, I would direct you to the following links: the Concurrent Disorder Capacity Building Team Clinical Tools and the Concurrent Disorder Capacity Building Team Community Resources. Thank you.